Today is a momentous day in that we will now do the first GPS navigated shoulder replacement in all of East Tennessee. We use GPS and navigation-based technology just like in robotic knees and hips. So we're able to utilize that technology, but I still ultimately, as the surgeon, have the final say-so on where those implants go. We have a patient today who not only does he need a shoulder replacement, but he needs a special type of shoulder replacement.
I've had 2 rotator cuff surgeries on both arms, but I tore it again about 4 years later. So now what's happened, the tendons that hold the rotator cuff together have shrunk to the point they can't be reattached to the bone.
We have the added benefit of knowing that we can put those implants in the perfect position using real-time feedback in surgery with the computer-assisted shoulder replacement. And so people ask, well, what's the difference in robotics and in navigated shoulder surgery? Well, the difference came into play for Ray. The final decision is made by myself, and I get real-time feedback from the navigation and from the GPS that told me, hey, we were planning A, B, and C, and we're 95% of the way there, but we probably should tweak this one little piece here that's going to give him a better result. And so getting that real-time feedback for me is what takes a good outcome and makes it a great outcome. For Ray, he told me that at about 2 to 4 weeks out from surgery, his preoperative pain was gone, and here he is today at 6 weeks from surgery. His motion is nearly symmetric with the contralateral side. He's able to reach overhead better than he's been able to do in years, and that's where he is today, almost pain-free at 6 weeks.
Well, the pain before was in the shoulder joint itself. I think it was not allowing me to get over my head. That's all been corrected. I couldn't get over my head. Like, this one goes great. This one to get to here. Now I can go all the way up. So it's 100% better, 200% better.
Nothing makes me happier than seeing him happy and feeling better and doing well.
I can reach a plate out in the cabinet, I can pull a towel out of the closet, reach the medication I take.
It's exciting for me because I'm passionate about technology and providing excellent outcomes for our patients. I couldn't be more excited to have been able to perform this as the first GPS-guided shoulder replacement in all of East Tennessee being done here at Parkwest Medical Center. You don't often get the opportunity to be the first and best, and I think right now we're able to offer now the first and the best shoulder replacement